My name's Chad Brough. I'm the Vice President of Growth at CQuence Health. I've worked in healthcare for over 30 years. Had the opportunity to work both on the acute care side in community hospitals and academic medical centers. I spent some time in the home care market, and now I have the opportunity to work with founders of innovative companies, entrepreneurs that are trying to improve healthcare in that space, selling into healthcare, trying to improve patients' access to care, trying to improve the lives of those that deliver healthcare across the United States. The job of delivering healthcare has become more and more difficult over the last 30 years of my life, and watching what has evolved and what has changed and the pressures that are put on people who are delivering care. Today, I think what's really important is that we are out there looking at companies that are delivering healthcare in different ways, that allow us to reach patients that live in rural areas, allow us to reach patients that are in areas that maybe have been underserved in the past. The changes that exist in healthcare today are happening more rapidly than ever. Some of the changes we've never seen before. Technology is changing so fast today. What that means is there are more solutions than ever trying to improve healthcare. We want to work with companies that are really focused on not just their solution, but the problems that exist in healthcare, and making sure that their solution fits specifically with the problem that healthcare providers are trying to overcome. And so we have to be there to help them pivot and understand the dynamics that exist in selling into healthcare, whether it be the leadership turnover in the C-suite and how they make relationships in the sales process, whether it's bringing capital solutions to the table and how their product or solution is financed, and especially how they may help the workforce challenge. And we have a team of people here at CQuence Health that have been in and around healthcare for sometimes 4 decades. And we really understand what it's like to sell into healthcare. Our company feels it's really important if you have a technology or a product that it's wrapped in service. We have experienced that ourselves with our own companies, that when you have a product or a solution, a technology that's wrapped in service, the adoption by healthcare happens much faster. As we work with startups, we want to be there as a partner that helps them balance the big picture strategy along with the day-to-day speed of decision making. So when we work with companies in our portfolio, we want to work with them first to start an annual plan and a strategy. We want to help them develop forecasts and really stick to a plan and be disciplined, but at the same time pivot when necessary. Often that's just a continuous cycle of what's the big picture strategy for this company, how do they adjust the product and its market fit based on customer feedback and what they're hearing when they're out in the healthcare environment, and how do they then modify and put their team together in such a way that's critical for success. Selling into healthcare takes time. We are someone who wants to grow with you, even if it means that it's going to take a decade to get where you want to be in scaling your company. We have experts, whether it be marketing, HR, finance, that will help you build the most important core business functions while you are also able to focus on selling, scaling, and fitting your product to the market. Before I joined CQuence Health, I often found myself receiving calls from new solutions, startups, innovative new products in healthcare. There are a lot of people who seek to change healthcare and improve healthcare. Today, healthcare innovation is not for the faint-hearted. It takes time, it takes resources, it takes a team of experts to be behind you as you're really trying to scale your company. I believe CQuence Health is the partner that innovative new companies need to help them stand out in a very competitive market. We are not someone who is quickly wanting to work with somebody and move on. We want to be there with you for the long haul because we believe it takes time to really build your company in a way that is patient as healthcare adopts your solution and the innovation that's going to improve access and outcomes.